name is Pia Shneider. I work for the World Bank. I would like to thank Professor Rima Sassin Kassan for inviting me and the World Bank to present at this conference. And I would like to thank big time to all the nurses in Lebanon for their crucially important work in the health sector. This presentation is about health financing and how it is linked to your work as nurses. I'm very sorry I cannot be in Lebanon, so I will show you this presentation virtually, and I hope this is going to work for you. So let me just switch to the screen. Yes. So this is my first slide. The health financing includes 4 steps. The first is about raising resources. The second is pooling these financial resources. Then the third, transferring resources to health providers, including hospitals, clinics, and pharmacies, and then financing the provision of health care. Resources is really from 5 sources. The first one is the allocations from the government through its tax revenues. And as you know, you pay taxes on income, assets, and consumption. The second is the payroll tax or contributions that you pay to a social insurance or to some compulsory insurance, like the National Health Insurance Fund in Lebanon. Then premiums charged by voluntary health insurance. Then out-of-pocket payments paid by patients. These are also user fees. And the fifth is domestic and external resources that come in through the NGOs and development partners. All these money together are the resources that come into the health sector. Now, as countries become richer, they spend more on healthcare. And as you can see here in this graph, on the right top end, we have the US, Germany, France, and the UK. They spend much more per capita, per person, per year than countries like Jordan, Morocco, Tunisia, Egypt, and India. And actually, Lebanon total health spending per capita is, or per person, is $118 in 2021. And that's about the same as what India was spending, what Egypt was spending in that year. Now, there are several factors that actually influence total health spending in a country. These are the resource needed and the resources that are available. So if we look first on the right side, the resources available, these include how much the government and social health insurance can raise from taxes, to what extent health is prioritized in the budget compared to other expenditures like education, then how much beneficiaries are actually contributing to insurance premiums and co-payment. Then another important resource is financing from external partners, mainly in lower income countries. And the last one is the efficiency of allocations. We can also gain some additional resources for the health sector if we reduce spending, for example, on administrative costs, to spend more on the healthcare provision. On the resource needs, if we start from the bottom, we need more resources depending on how a health system is organized. If we have lots of hospitals, we need more health systems, we need more resources. If the demand and utilization of health care is very high, we also need more. If the costs of input factors are high, we need more. Then the extent of benefit package, how much is covered, will also define how much we need. And the demographics of a society, if a population is older, we also need more. And if everybody is covered, we need more. And if the disease burden of a society mainly includes high-cost diseases, that will also require more resources. Now, let's just look at this, what that means for Lebanon, actually. These are the diseases that cause the most deaths in Lebanon, the 10 diseases that cause the most deaths in Lebanon. And if we look at these include ischemic heart diseases, stroke, lung cancer, hypertensive heart diseases, Alzheimer, chronic kidney diseases, breast cancer, colorectal cancer, lower respiratory infections, and diabetes. Many or most of them are chronic diseases, and many of them require very costly treatment. That means that, we need a lot of money to come into the sector to finance the treatment of patients that have these diseases, which also makes actually prevention of diseases very important. And I know this is important to you because nurses and doctors in Lebanon work on prevention. And that means that you, for example, help patients or people reduce all these risk factors that actually drive the most deaths and disability combined. So if we actually look at these risk factors and which are the most common risk factor, then we see again that smoking tobacco is the main risk factor for death and disability in Lebanon. And this is directly linked to the third most frequent disease that we saw in the previous slide, which was lung cancer and other cancer, ischemic heart diseases as well. So risk factors such as tobacco consumption, high blood pressure, high body mass index, high fasting plasma glucose, dietary risks, these are factors that can be prevented and they contribute directly to these high cost diseases. And you as nurses are playing an important role in monitoring and curbing those risk factors. Now, from a health financing point of view, we can also play a role, and what countries are doing, they are actually taxing these risk factors that contribute to high-cost diseases, disability, and death. And what we actually do see, and this is important because we do see that increasing mortality, morbidity, and health costs due to tobacco, alcohol, and sugar-sweetened beverage consumption in the Middle Eastern region is increasing. And this contributes to increasing economic costs. And these economic costs, especially of smoking, are increasing from 1.2% of GDP in a low-income country to as high as 2.2% of GDP in a high-income country, which means that rich countries are actually spending quite a bit of their income, their total income, on these high-cost diseases related to smoking. So preventing it would give us some money. Now, what has been done? This is just as an example. Many countries have introduced tobacco tax. This is the example from the GCC countries. They have introduced tobacco tax in 2016. Here is what happened in Saudi Arabia, UAE, and Qatar. The blue line is the sales volume for cigarettes. And as you can see, it has gone down tremendously. It has dropped since 2016. That is when the tax was introduced. And this has resulted in doubling of price for tobacco in Saudi Arabia and Qatar, and the price has increased tremendously in the UAE. So the bar shows the price. So actually increasing the price can influence the consumption of an unhealthy product. Lebanon could do that too. It could tax tobacco, alcohol, and sugar-sweetened beverages to curb the consumption and raise additional resources. Since 2018, taxes are not being implemented in Lebanon. As we can see here on the left side, cigarette prices have dropped and sales have increased. These are again the blue line. And if we compare Lebanon against the other Middle Eastern countries, then we can see that Lebanon and Iraq are the only MENA countries where actually cigarette sales have increased. Lebanon here is the violet dotted line and Iraq is the blue line. So increasing these taxes or reintroducing these taxes could help reducing smoking in Lebanon and also support your work in prevention that you are doing in the health facilities and hospitals. Now let's talk about risk pooling, which is the second step in health financing. The goal is to increase risk pooling. And this means that we reduce out-of-pocket payments that patients pay when they use healthcare. And the argument is that they are a barrier to access and they cause impoverishment. And we want to have more people in the risk pool and more money in the risk pool, so that then the pooled resources are in health insurance and government, and they are then efficiently transferred to pay providers, and healthcare providers can use the money to deliver the basic benefit package in health facilities to patients. Now, once healthcare providers, including hospitals and clinics, receive the money, what are they doing with it? They use the money to finance the provision of healthcare, including paying for salaries of staff, medicines for patients, medical material, medical equipment, infrastructure, investments, and maintenance costs, and many more things. So that is how the money will be used. And clearly, if less money is coming into the sector, then that means fewer things can be financed in a hospital, and it directly influences how your work is actually being done. If you receive more money, you can do more. If you receive less, you can do less. Now, the fourth part in health financing is about the basic benefit package. What can actually be covered by government? To what can we assure universal access for the entire population? Now, as you know, no country can pay for all health services that are being made available in the health facilities. And that's the reason why all countries around the world have to define a basic benefit package. And this basic benefit package is financed by government and compulsory health insurance. Because we can't finance everything, governments and compulsory health insurance companies have to prioritize the most important diagnosis and treatment within the available resources that can be financed. And that requires explicit criteria to prioritize the diagnosis and treatments for inclusions. Because not everything can go into the basic package, we still can offer voluntary health insurance for coverage for all the services that are excluded from the basic package. And then there are always a couple of things that are not covered by anyone, neither by voluntary health insurance or by the basic package. And these things, they need to be paid out of pocket by patients. That is normal in each and every country. So if we actually look at the basic benefit package, what is usually covered, then this is pretty much the same across the world. Usually it includes maternity, reproductive health, newborn and child health care, prevention, chronic disease management, such as for diabetes, asthma, hypertension, psychiatric care, comfort care, including palliative care, hospice care, and pain management, treatment to cure fatal conditions such as appendectomies or treatable cancers and dialysis, all primary health care, and all the diagnostic services such as laboratory, X-rays, and other diagnostic services that are needed to actually identify and diagnose a patient. So if a country has more resources, more can be covered and included in this basic package. But a country that has less resources coming into the health sector, cannot cover that much. So how much comes into the health sector, how much revenue we actually can collect, how much resources we get, directly influences how much can be covered. Now, the basic benefit package needs to be updated annually, at least annually, if not regularly. The reason why is because new medical technology becomes available, so decisions need to be made whether this should be included or not. Illnesses evolve, new illnesses come and show up, like COVID a couple of years ago, and the financing changes. Perhaps next year you have more money than this year, which allows you to cover more. So it's important to keep this flexible and to have a commission. Usually countries have a commission that decides about these points and what should be added, and then defines the basic benefit package for coverage in collaboration with the health financing people from the health insurer and the government. Let me stop here and just say a couple of words about the World Bank's work in Lebanon. The bank has been working for the Lebanese government in collaboration with the Lebanese government for a couple of years now. In health sector, we support the government in its reforms efforts with two projects. One is the COVID-19 support project that has been going on for a couple of years. It finances the procurement of Pfizer vaccines, syringes, gloves, hospital equipment, ICU beds, patient fees for COVID admissions, and many other things. And the other project is the Lebanon Health Resilience Project, which finances improved access to quality healthcare services to poor Lebanese and displaced Syrians in Lebanon, and it also strengthens government capacity to respond to COVID-19. Let me end here on that note and say a big thank you to all of you for your attention. This is a bit a dry topic. I hope it raised your interest in the topic. It's an important one. And I wish you a very successful conference. Thank you again for inviting me. Have a wonderful day and a lot of interesting discussions. Thank you very much.